we have here a very special guest of mine. Her name, well, actually, what I'd like to call her is the weightlifting therapist, but everybody in the gym knows her as Sam Nar. Welcome to the show, Sam.
Hi. Yeah, I'm female Sam. We have a couple, I guess we have one male Sam.
We do, yeah.
I always get referred to as female Sam if both of us are in the gym at the same time.
I've actually never heard of that in a class.
Yeah, when Guy Sam's, he's been going to mornings lately.
Yeah, he's been early in the morning.
Yeah, but when he used to come in the evenings, or like when we would come like 4 o'clock together, I got the girl Sam, Guy Sam.
I've never heard of that.
I mean, it's a quick,
right,
easy guide, I suppose.
Yeah, no worries. So the reason I call you the weightlifting therapist is because of your background when you're not, putting 200 pounds over your head like it's nothing, is because of your job status. Mm-hmm. Or I wouldn't say even job status, it's what you pursued to do to help people.
Yeah, my career.
So what made you kind of go with therapy route?
Yeah, so I guess I'll start by really specifying what kind of therapist I am, because I get that question a lot. So when you say therapist, people, will go, oh, you're a physical therapist, or oh, you're an occupational therapist. And so I'm a mental health therapist. It's funny, when I was in grad school, we would talk about the terms of, counselor versus therapist versus, whatever. And one of our professors gave us an example of this salesperson that was, I think they were selling adult diapers, and they they refer to themselves as a counselor. You call them and ask them questions about these adult diapers or whatever. And
so they were a counselor for adult diapers.
Yeah. And so it was just an example, a silly example of, how muddled the terms and all get. But yeah, so I'm specifically a mental health therapist, which means that I work with individuals who are dealing with any kind of mental health issue, whether that's depression, anxiety, bipolar disorder, other more severe mental health disorders, and then also addiction, substance abuse issues as well. So
what do you feel like you have the most clientele or patients wise?
Yeah, so I call them clients.
Okay.
So that's another difference too. Usually patients are referred to when it comes to a doctor. So psychiatrists will sometimes call them patients.
So could a psychiatrist refer their patient to you?
Yes.
Okay.
Yeah, I just refer them as clients.
Yeah.
And honestly, to me, patients makes you sound sick. You're sick. And yes, there is mental illness, but I wouldn't say my clients are sick. They just have some unhealthy, behavior sometimes that we need to work on. But yeah, so to answer your question, the majority of the people that I work with right now, since I've stepped into the private practice world, are individuals who have, depression, anxiety. I have some clients with bipolar disorder. It's a lot of depression, anxiety, to be honest. I have a couple of clients who struggle with some substance abuse, but not as much as I have worked with in the past. And then I'm kind of branching into working more with clients with OCD, so obsessive compulsive disorder.
Yeah.
I have a training plan this summer, and I'm hoping to start specializing in that, because we're kind of lacking in that in the Indianapolis area. So.
Have you noticed that going from not private to a, would you say corporate with community and
more
then
community mental health, through a hospital organization?
Yes, hospital and then into a private practice. Has there been a difference with things in that nature?
With diagnosis, a little. The thing with mental health is it affects everybody. It doesn't matter if you're rich or poor or where you live. When I worked in a hospital organization, I happened to work in a lower socioeconomic status area in Anderson. And so a lot of those clients had the same kind of mental health issues that I'm working with now, but they experience them in different ways, right? Because they have less money, they have less opportunities, they have, it's just a different experience in their environment. So I would say now, I'm working with the same types of issues, the depression, the anxiety, but these individuals who I'm seeing now in the private practice world, typically hold a job fairly easily. They get up and they do the quote unquote normal. I hate the normal, not normal kind of argument, but
I don't even think we know what normal is anymore at this point.
No.
Somebody's normal is somebody's abnormal.
Yeah,
basically.
It's a setting on your dryer, I think.
Or your dishwasher.
Yeah, it's running in the background. Yeah. So they get up and they do things to function, like going to work and paying their bills and things like that.
Adulting.
Yeah. Yes. I mean, hopefully, but it's different in the way that they experience their symptoms because their symptoms just make all of those things harder. They're still able to do them. And I think it's, it also goes with like how many supports you have and the educational background. I mean, there's lots of factors that play into it, but yeah, in summary, it's different, but the same.
Do you think some of it could be their lifestyle or how they were kind of, I know a lot of it, like with kids, especially how they're kind of raised and brought up and what their normal is supposed to be, oh, well, when I'm older, I'm supposed to be like this.
Oh, yeah.
Like, do you feel like that has a big effect
in
mental health? Definitely.
I mean, yeah, there's, nature and nurture that goes into it. So the nature of, like, does your family have a history of mental health issues? Yep. I mean, that plays a role as well. But nurturing, if you grow up in a family who functions fairly healthily, I mean, there's dysfunction in every family. But if if you're surrounded by people growing up that are teaching you more healthy things and healthy ways to live, then you're typically going to carry that through to adulthood versus if you come from, a really chaotic childhood and, your family struggled for money and there's always, an exception. Like people find their way out of that and they learn and grow and maybe they do therapy and they get better. But definitely your upbringing and what you're taught early on plays a role in how you are as an adult and if you're able to be, resilient to issues that come up. So,
I mean, I honestly, coming from my point of view on mental health, I don't know much about it except for like hearing other people's stories, having friends that have the courage to kind of like talk about it with other people. I know some people, they're very shy to let that side in. So as a therapist, how do you kind of bring that out to be like, hey, I'm here for you. I'm not here to judge you. Because I think that's the biggest thing that I have noticed with kind of like my age group or even high school kids. It's like high school kids are still trying to figure out what they want to do or who I even am.
Yeah.
I guess what I'm trying to say is like, how do you bring that out? Like, it's okay to talk about it. Like, let it free, let it go. Like,
Yeah, so I mean, I think it depends on every person. The nice thing about generations now, our age group and the
Sam has 2 dogs, and I think one of them just farted, and it smells really bad where I'm at. And like both their butts are towards me right now, and it smells bad.
Guarantee you, it was Maya.
God,
my boxer smells so bad when she farts.
Oh my God, I'm sorry, Sam, but that was I just made an ugly face because that was. Oh my God,
I should have warned you about
that. That is a man's fart. That's not like, jeez.
She's a princess.
That's a princess fart, I guess. God, I think that's worse than mine sometimes.
Oh,
man,
I doubt that.
You know what? You gotta know. But go ahead, as before your dog farts again, maybe it'll burp this time.
Kai's the burper. Yeah, I have 2 dogs and they function as like little toddlers. But I actually don't remember your question because I'm thinking about farts now.
That's what dogs do, man. So going back to my question, it was like, how do you bring out being comfortable
right
talking about?
Yeah, so I think, generationally, we've done better. I'm a millennial. I fall into that category.
Uh-oh.
I think
How do you feel about all the TikToks? 'Cause you watch a lot of TikToks.
I love TikTok.
You watch a lot of TikToks, and there's a lot of millennials.
I have no shame in my TikTok game.
I know, you send me some videos. I'm like, what the hell is that?
No, but, your generation. Well, are you a millennial or are you Gen Z?
I've been called millennial, and I've been called Gen Z.
Okay.
I'm going to say Gen Z.
Yeah, you strike me as a little more Gen Z than
yes.
millennial. I'm not complimenting you.
Thanks.
But Sabrina and I have had this argument too of what she is. But yeah, so I think our millennials and Gen Zs have done a really good job about being more willing to talk about things.
Yep.
Older millennials, I think, are still kind of on that edge. Like my brother, it would be he's not old. Millennial, but older millennial because he's about 5 years older than me.
Okay.
And so I think his age group still kind of had that like, is it really our therapist really trustworthy? Is this really okay to like talk about, you know? And my parents are in their mid, you know, to late 50s, and they're the generation of like, keep it to yourself, like
keep it to yourself, move on. Yeah, you're fine.
Yeah,
keep going.
Pull up your bootstraps or whatever, and keep moving. Yeah. So I think generationally, we have done better with being willing to talk about hard things. So when people come to me, I think they already, for the most part, not everybody, but most of my clients already know, like, hey, if I'm going to a therapist, like, they're probably a trustworthy person. Okay. They have the training. Like, there's laws about confidentiality.
No, everybody knows about HIPAA.
Yeah, so that they can expect to, you know, what they say to be private. But I think it's more building a relationship of trust. So, like, you know, somebody might tell me things, but they might not trust me. And that comes back to, you know, whether or not you have healthy boundaries or not. Because some people will tell you anything and everything, and there's really no depth to what they're saying. They don't actually trust you. They just don't know what healthy boundaries look like, so they just go and spew all their crap to everybody.
Right.
And so there's definitely that element of, like, getting to know each other, and I think just through, like, genuine interactions and I mean, I think a lot of people know this, but the majority of successful outcomes in therapy comes from a positive rapport with your therapist. So if you're able to build a healthy, strong relationship with your therapist, like, studies show that you're going to get better.
Right.
You know, a majority of the time. Like, that's not everybody. That's not the only factor at play, but it's the biggest factor that studies have shown.
Is that because you are sharing your personal struggles with a different person? And like you said, creating that connection of trust and feeling comfortable knowing that whatever I say right now in this very room is not going to blackmail me. It's not going to backfire on me. Right. And, you know, kind of things like that.
Yeah, I'm telling it to a person who is here to support me and doesn't want to do anything more than to help me get healthier.
Right.
You know, there's no agenda. Whereas, like, you may have relationships in your life where if I tell this person something, like, can I really trust that they're going to keep it to themselves? Or like, how are they going to use this against me later? Which some of that thinking I think comes from, like, you know, trauma and things that you've experienced. But
high school, probably.
The traumas.
Every single high school movie there's always the mean girl, the girl that gets bullied on, and then the girl, she wins, and all this thing like that. The guy is just oblivious to everything anyways, which is fine. But, no, I think that's definitely something that people just kind of don't realize. I hear your neck cracking, by the way.
Mm-hmm. Yeah. Oh, I had the shoulder surgery a month ago, so, like, sitting
Oh, yeah. Still, how is that?
It's good. It's getting better. I'm in physical therapy. I can only do, you know, so many things at the gym, which sucks, but
you're still going to outlift us when you come back.
That's the plan.
That's the plan.
Yeah.
So your plan is, okay, I'm going to do super good in therapy, and then once I get back, y'all bitches are in trouble.
Exactly.
Sam's back.
Yep.
What was the most you've clean and jerked before your surgery?
At the same time, 205.
205?
Yeah.
For a clean and jerk?
Mm-hmm.
That's awesome.
Yeah.
Like, and
that was while it was torn.
While it was torn. This girl, what'd you snatch when it was torn?
160, I think.
160?
Yeah.
So when you were torn, your shoulder was not completely torn off,
yeah.
but your labrum was slap tear, right? Mm-hmm. Or something like so partially torn, not fully. She goes and does 160, and then Sabrina thinks that 170 is freaking awesome, but granted, Sabrina was fully healthy.
Oh, I mean, Sabrina's 170 is great, but it's not going to last. Just let me get
Sam's
healthy.
coming back, you guys. I'm telling you, you're just going to out-squat us because basically you've been doing all a bunch of leg work, right?
That's all I can do. I have to avoid my arms, so it's like core and lower body stuff right now. So.
Yeah, we're in trouble.
Yeah.
We can't call you too skinny anymore either.
Oh, you can still call me that.
Oh, okay. Just a little background. Sam has been doing an awesome job with her weight loss goals and hitting her macros. And as a coach, she comes to me and talks to me about this, and I'm very proud of her for what she has put through. Thanks. Especially, I know how she likes her beer and her pizza and
I love carbs.
All the carbs you could ask for. That is great progress.
Yeah, it's 20 pounds since February, so
yeah,
it's good.
You're thick girl summer.
It's good stuff.
Thick girl summer. So, I mean, with a therapist position, do you kind of give your clients suggestions on coping skills? Like,
yeah. So And so I guess while we're talking about it, I'll give you like a myth of therapy that's actually a myth and not the truth.
Oh, myth busting? Yes.
We don't give advice. So a lot of people will say like, I just want to talk to somebody and get some advice. That's not my job. And if you have a therapist who's only giving you advice all the time, you should probably find a new therapist because that's not their job. My goal and my job is to help people